Hello, everyone. Thanks for coming to our webinar this evening. My name is Vernon Bryant, and I will be your facilitator this evening, your moderator. I am a community worker, community organizer, and primarily doing work in the center of the county in the community called Ridgecrest, which is just on the southwest border of the city of Largo. As faith leaders, we are in a position to assist our unique communities with this historical vaccination process. I'm sure, like me, you've heard lots of confusion, frustration, mistrust that surrounds this whole thing. When our congregants and when the people of our community come to us, we want and need to have answers. So we're going to have a conversation this evening, and we hope that this will help each of us to take positive steps forward to help our faith-based communities contribute to what is really a historical process. We're going to provide some education, and more importantly, we're going to have a guide to help you find where information is and to give you some tools and assets to help you as you are becoming part of this. So with that, I want to just kind of quickly introduce who our panelists are tonight. The first is Tracy Harvey, who is a doctor of pharmacy, and she's the director of pharmacy and DME operations for Empath Health. Then we have Gayle Guidash, who is the assistant county health department director with the Florida Department of Health here in Pinellas County. A great friend of mine, Reverend Kenny Irby, who is director of community intervention and juvenile outreach for the St. Petersburg Police Department and pastor of a great church down in the St. Pete area. And then Arelys Escalera, who is the community outreach coordinator for Pinellas County Marketing and Communications. So before we get started, just some housekeeping. This webinar is being recorded, and the chat and the Q&A will be saved. The chat is open, so feel free, please, to go ahead and introduce yourself. You can add comments and add your own ideas and resources as we get through in various parts of it. If you want to ask questions, and we definitely encourage you to do that, there's a Q&A button at the bottom on your screen or somewhere on your screen that you should find, and we will be monitoring those questions throughout the evening, and we will try and get to many of those questions if we can. If we don't, we will make sure they get answered, and that will be part of the information that will be sent out afterwards. During the program, your microphone will be muted and your video will remain off, so you'll have to see our lovely faces. And again, we will follow up this webinar with information that we were not able to cover. We'll share resources, and we will also send you a link to this recording so you can share it with others. This webinar will also be posted on the Pinellas County YouTube channel for future reference. So with that introduction and all those things, this is a faith-based program, so we're going to ask Reverend Kenny Irby to guide us in a moment of reflections.
Thank you, Brother Bryant. We appreciate you and all of those who are on this panel and to this august aggregation that is assembled here tonight. Let me ask you to center yourselves wherever your feet are on the ground. Let us just turn to the Creator in a moment of prayer for places of faith. Oh God, our God, how excellent is your name. God of grace and mercy and might, we come to you tonight, leaning not on our own understanding, but in all our ways, we acknowledge you and your love for your created humanity. We ask that in the presence of this time, God, that you would guide us and guard us as we seek to serve and to save lives. This we ask in the most mighty, matchless, and high name, the Creator God, we pray. Amen.
Amen. Thank you, Reverend Irby. First and foremost, to understand our role as the faith-based community in this vaccination process, we want to give you some background and help you understand the vaccine and the vaccination process itself. So joining us again today is Tracy Harvey, who is a doctor of pharmacy and the director of pharmacy and DME operations for Empath Health. Tracy, thank you so much for joining us. We're going to ask you to do your magic and help us to understand what we're doing and what the vaccines are all about and how they work. So, Tracy.
Sure. Thank you for having me. I thought it might be useful before we start talking about the specific vaccines that are available to talk about how vaccines work in the body. So in a natural infection, your body is going to try to fight off the invading bacteria or virus by creating proteins called antibodies. Each antibody is specific to the bacteria or virus that has been detected in the body, and it triggers a very specific immune response. If you fight off the infection successfully, these antibodies remain in your immune system after the infection's gone. So if you encounter that same disease again, your immune system has a memory of the disease, and it can quickly destroy the next invader before you get sick and get symptoms. Vaccines are basically a safe method of exposing your body to a disease without actually infecting you with the disease. They train your immune system using a harmless form of a virus or a toxin that's produced by the virus or bacteria. So in this way, they can stimulate an immune response without actually causing illness to the person. When we talk about the COVID-19 vaccines, each one has a different method of producing antigens, which are the unique features of the SARS-CoV-2 virus to your body. The antigen triggers a specific immune response, and this in turn builds immune memory so that if you come across the infection in the future, your body is able to fight it off despite never ever having actual infection with the COVID disease. How long immunity will last will actually depend on the type of vaccine. So the first vaccines we want to talk about are the ones that are on the market now. And those are messenger RNA vaccines, or a type of vaccine called a genetic vaccine. The way that this works is that it contains messenger RNA, which is basically a set of instructions for building proteins. And the proteins that it builds are the proteins that are on the surface of the coronavirus. So you've seen lots of images of those. It looks like a crown. There's something called a spike protein. So this teaches your cells to make that protein and put it on the outside of a cell, which then activates your own immune system. You never get the actual SARS virus in your system. You are just getting a small protein which is on its surface so that it can train your body that if it encounters it in the future, it will build an immune response. So the two vaccines that are available in the US today, the Pfizer-BioNTech and the Moderna vaccines, both use this messenger RNA technology. They are very quick to develop, and we'll talk a little bit about the development timeline and how this makes it very easy to develop vaccines. But they have some downsides in that they have to be stored at very cold temperatures. So that can make distribution a little bit challenging. There are other messenger RNA vaccines in development right now, and this technology actually has been in development for over a decade and continues to be explored for other types of viruses. In our next vaccine type, we're going to talk about viral vectors. So the one that is closest to market in this phase is the Astrazeneca vaccine that was developed in conjunction with the University of Oxford. Now, this viral vector vaccine takes a virus that is not endemic to humans. So in the case of the AstraZeneca vaccine, they're actually using a chimpanzee virus, and they modify it, again, to carry instructions to manufacture the COVID-19 spike proteins. So this virus is not harmful to humans. It's basically just used as a delivery mechanism to deliver these instructions into the cell. They generate a very strong immune response and have been shown to be effective in Ebola vaccines as well. So this is, again, not a brand new technology, but has been in development for a while. These vaccines also need to be stored at low temperatures, but not necessarily at the cold frozen temperatures of some of the messenger RNA vaccines. And then in the last vaccine type I want to talk about today, it's called a protein vaccine. So our next ones that are likely to be coming to market would be in this category. There are none approved in the US yet, but basically these are vaccines that just carry proteins in them, and they trigger an immune response by delivering these recognizable proteins to the body. They have been used in lots of other vaccines, so our hepatitis B vaccines, shingles, pertussis, which is part of your DTP or diphtheria and pertussis vaccine that you might get. So this is an older technology. It takes a little bit longer to develop it because you have to build all of these proteins for manufacture, but it does have a long track record of being a good and effective vaccine. The one limitation here is that they do typically require additional booster shots. So like with your pertussis vaccine, you're going to need to get that several times in your lifetime. You know, most of the vaccines that we're developing right now for the coronavirus disease do require some form of booster. There are a couple of single shot forms out there still, but this one again is an older technology, so it's a little bit more known. That's definitely going to require these additional booster shots. Moving on, we want to talk a little bit about that timeline and how these vaccines were developed. I think a lot of people are nervous because it seems like these came to market very quickly. The truth of it is, though, we've been in research and development, particularly for the messenger RNA vaccines, for over a decade. The benefit of that type of vaccine technology is you can modify them to produce different proteins, so they can be very quickly modified and manufactured. Unlike some of the older technologies that use an inactivated or a live weakened vaccine, where you actually have to grow and produce those viruses, like the flu vaccine in egg cultures, you don't have to mass produce that level of biotechnology. You simply create the instructions and it's very quick to modify from there. The added advantage is because the name of this virus being SARS-CoV-2 is actually the second time that we've seen a SARS virus cause an epidemic. So over a decade ago, we saw the original SARS virus, and we got a lot of knowledge out of that epidemic. And we also benefited from the fact that structurally these viruses are very similar. And so it was very quick adaptation in order to produce the vaccine. We had a lot of governments dumping a lot of money into development. You'll see that most of the Western governments were contributing to research and development, as well as providing funds for manufacturing. So that certainly helped. And we also were able to kind of shorten the time frame when it came to overlapping the clinical trials with manufacturing. In traditional vaccine development, you're going to do clinical trials and watch and see how they pan out before you actually start making your vaccine, because it's a bit of a gamble. You don't want to lose money making vaccine that ends up not being effective. In this case, almost all the manufacturers started producing vaccine very early while they were still in the clinical trials, because they had a good idea that their vaccines were going to be effective. And so they were able to overlap those timelines. They actually overlapped the phase 1 and 2 trials and the phase 2 and 3 trials, which helped shorten the development timeline as well. They didn't skip any of the phases. So a phase 1 trial is typically your safety trial, whereas your phase 2 kind of expands the population that you give it to make sure that it's safe in a wide range of people in demographics and age groups. And then your phase 3 trial is your efficacy trial. So it helps you find the right dose and make sure that the vaccine is effective. So they were able to just overlap the trial phases in order to shorten that timeline. We had a large pool of volunteers that were available for those trials because there was a lot of interest in people who wanted to help with the development of this vaccine. And then worldwide, and especially in the US, our regulators developed a very agile response to this and allowed them to submit for approval earlier to kind of speed up the timeline for approval. So they were submitting data for these vaccines very early on. So that phase 2 trial data was going before the FDA back at the end of the summer last year. And so by submitting on a rolling basis to our regulators, the FDA didn't have to wait to go through all of the clinical trial data at the time of submission. They had been reviewing it very early on. So what we ended up with was a timeline of about 11 months from the time that the first genome was sequenced of this virus to when it was released. So there's been a lot of conversation about, are these vaccines safe? And a lot of that centers around the type of technology, being that these are the first vaccines to come to market using those messenger RNA and other viral vector technologies. And then also this concept of the emergency use authorization. So the FDA, without doing a full approval, has something called an emergency use authorization. So it's designed to prevent serious or life-threatening disease or conditions when there's really no adequate alternatives. And so this exists for both medications and for vaccines, as well as medical devices. It's important to note that under this approval, as well as full FDA approval, the vaccine undergoes all 3 trial phases that are required of any medication or vaccine in the United States. The slight difference with the emergency use authorization is that it is approved for earlier use, but there has to be ongoing safety monitoring and clinical trials and an expectation that all of that data will be submitted again for full approval. They cannot market these without a full FDA approval. They just simply can be used in order to speed up protection of the community. In the US, up through, this was Valentine's Day data, 52 million doses have been administered. So we do have a large population, even outside of clinical trials, who have received the vaccine. The side effects generally have been very mild. They are more common after the second dose, but typically you'll see pain at the injection site, maybe some redness or swelling, headache, chills, and fever are pretty common. There was a lot of concern early on that allergic reactions, also called anaphylaxis, would be very concerning with this new vaccines. There was some data that came out last week that showed that it is quite rare, and it's at similar levels to what you see with the flu vaccine. So it's not any more common with the coronavirus vaccines than with your annual flu vaccine. We do know overall that these vaccines that have passed emergency use authorization with the FDA are highly effective at preventing severe disease. There's more data coming out that will tell us whether they can actually prevent you from communicating that disease to others. And so that's why it's so important to continue social distancing and mask wearing, because although a vaccine will prevent you from getting severe disease if you get the virus, social distancing and masks will help you prevent you from getting the virus, period, so you don't have to fight it off. So Vernon, I'm going to pass it back to you to talk a little bit more about distribution in the community. You're muted.
Sorry about that. Thank you. We've been hearing about vaccine mutants, and just real quickly, can you tell us a little bit about, if we should be concerned about that with the vaccines?
Sure. So viruses naturally mutate, and the more people that they infect, the more chance they have to naturally mutate, which is why it's so important to get people vaccinated and to keep the virus from spreading in the community. There are a few variants that are in the news lately, the first and most prominent one in the US being the UK variant. That is fairly common in Florida right now, as well as the South Africa and Brazil variants. So they are researching right now, and there's some very early data that has come out that has shown that the two that are currently under emergency use authorization in the US, the Pfizer vaccine and the Moderna vaccine, both have good efficacy at preventing severe disease against those variants.
Awesome. Awesome. Thank you so much. Thank you. Let's kind of turn the page a little bit. And as this relates to our community, we have Gayle Guidash, the Assistant County Health Department Director with the Florida Department of Health with us. And most of you know that as the DOH. So Gayle, tell us about the rollout of the vaccines in Pinellas County.
Oh, see, I get the hard part. That's not fair. No, Tracy just talked to you about the authorization. So the vaccine was made, it's authorized for use. The federal government has bought it from the manufacturers, and now it's time to get it into people's arms. So this is the challenge. We know, and we've been told many times, that there is not enough supply at this point to give it to every American that we have. So we have to have a distribution plan to be able to give it to as many people as quickly as possible, because that's how we're going to get to that herd immunity, or the fact that as many people as possible have gotten the vaccine so they won't spread the disease from one to another. So in this particular slide, you'll see that right now, the state government from the federal government is pushing out vaccine to different locations like hospitals, pharmacies, community health centers, and the Florida Department of Health. And we're trying to find as many different ways to get vaccine out to the community as quickly as we can. Next slide. So when you don't have a plethora or a very large amount of vaccine to give, you have to make priority groups. And the CDC, the federal government, and even the state government have made priority groups with which we are going to target individuals initially in order to give the vaccine out as fairly as possible, but as much as we can to the high-risk groups. So it first started out with long-term care residents or staff. So we're talking about nursing homes and assisted living facilities, not only the ones that care for them, but the ones that live there 24 hours a day. We had a lot of outbreaks during this last year in nursing homes, and the results can be catastrophic because these folks have a lot of comorbidities, they're elderly, and the end result was not appropriate. So we targeted that group first, and we actually started the campaign in December 16th of 2020, and we pushed out thousands of vaccines to the community in order to protect this group. And like Tracy said, we went out to do one vaccine, and for the Pfizer vaccine that we used, we had to go out 3 weeks later and do it again. Also, along with that was healthcare personnel, those that were caring for COVID patients. So those in the community that were at hospitals that were having face-to-face contact were targeted initially from all the hospitals because, again, we wanted to protect them because they were at risk and being exposed all the time. Furthermore, we escalated that and added EMS and fire administration because they also were driving folks to the hospital, so we wanted to protect them as best we can. Finally, the governor, Ron DeSantis, decided that he was going to skip what the CDC decided to be the priority groups and add the people age 65 and older. And the reason he did that is because of, again, those poor outcomes for those that are elderly. So if you looked at the different groups who were getting COVID, their outcomes were the worst. In fact, they were the ones that were dying at the highest rate. So his philosophy was to start with the people that were 65 and older, and that way we could keep people alive longer. So it's a challenge for Florida, but again, it was a good thought to do it this way. Next slide. So for today, and you will be able to find out later on in this presentation where to find all these data, but for now, the total people vaccinated in Pinellas County is 127,000. So this is great news for us because it's about 38% of our population. It's going to take a while because we don't have enough, we can't go fast enough, but we're getting to people who really need it first because we're trying to save their lives. And, you know, like Tracy said, we are getting vaccine out to the community, but we still don't have enough. So don't take that mask off because you still have to socially distance. You still have to wash your hands. I've spoken to a lot of grandparents that are so excited to see their grandkids. But don't forget, these vaccines are like 95 or 94% effective. It doesn't mean that you're perfectly never will get the disease. So it's very, very important for people to understand that you still have to do the specific measures to keep yourself healthy because we don't want any breakthrough disease to come from people who just let their guard down. Next slide, please. So the good news is that Pinellas County, our partners, have really done a great job in putting information out to the community because people are saying, where can I get a vaccine? And it's not simple, I will be honest with you, because every different healthcare system, every different pharmacy, every different way is different. There isn't a one-stop shop to find vaccine. So my thoughts to you today, for those of you that are listening, is find the people that can help you. Find your grandkids, find the ones that are tech savvy, find people in your congregations that can help bridge this gap, this knowledge gap. So share the websites, share the information, watch all the social media so you can actually help people find the vaccine. It is not the best system because it's very technologically heavy, but it helps us provide the most vaccine as fast as we can to the biggest population. So it is incumbent upon you to learn as much as you can about this website and other websites to sign up, because we want you to sign up as many places as you're comfortable in order to get that vaccine as fast as possible. Next slide. There's also a site on the Department of Health website, and we'll share that link for you as well, where you can select your county and your city and look to see who is giving vaccine. Most of the large sites will promote it and say that the vaccine is available. So this is another opportunity to see if you may have not realized where other places you can get vaccine. Next slide. So for Pinellas County, our #1 go-to site is patientportalflorida.com, and this is a screenshot of what the actual site looks like. And what we're encouraging people to do is to go online and make an account. And even if you are not very good at computers, or you don't have a smartphone, have somebody in your family or have somebody in your congregation help you do this. It's really not very difficult if you have a little bit of savvy. You create the account, you ask for the account to text you or email you, and once vaccine is available, you'll get a code and you can go online and use that code to get a vaccine appointment. So it's really that simple. So we're encouraging people to help others to sign up. We've walked people through the system and just try to allow them to get opportunities. If you have grandkids, let them sign up for you. Tell them how to do it. It really is a great opportunity to get it as fast as possible. We are at this time doing about 10,000 doses a week, first doses, with this system. So it really has helped us do a lot of vaccine in a short amount of time. Next slide. There has been some discussion about a statewide sign up, and this is what the statewide sign up looks like. Unfortunately, Pinellas County is not using this. This was basically a waiting list, and this particular waiting list allowed people to get called back, but there are thousands and thousands and thousands of people on this list. So you're welcome to sign up with that, but currently Pinellas County is not using this list. We're using the CDR McGuire, the first slide that I showed you. So, please, if you need help or need assistance, we ask that you go to that website that Pinellas County has shown and look for the information there. Next slide. And finally, the main distribution points that we always know and love, where we normally get our flu shots and whatnot, are coming on board. So Publix is starting to get some vaccine. Walmart through Sam's Club is going to get vaccine. CVS and Walgreens are beginning. They've actually been doing a lot of assisted living vaccines right now. So they too use the targeted buckets to go out and do vaccines. But we really, really want to go out and get the vaccine out into the community like you normally get vaccine, in order to make sure that things are done as fast as possible. So I know that it may be confusing, and I know Vernon has some questions. So Vernon, what would you say if when I told you about how this worked, what questions would you have? And you're on mute.
I keep doing that. Sorry, you guys. More than anything else, I think, the people are asking, once I sign up on some of these sites, how long before I get a vaccine? And then also kind of related to that is, the panic that we kind of see in a lot of our seniors about it.
So just in Pinellas County alone, there are 250,000 residents that are over 65 and older. So with us getting about 10,000 doses a week, it is going to take a very long time to get everybody in that group, which is why we want Publix and Walmart and everybody else to take a crack at doing this as well. So we had at one point for the CDR McGuire site about 130,000 people signed up. So it's going to take a while, which is why people are frustrated, because they hear that it's coming and they hear that you can get it, but they just can't seem to get it. So we're really working toward getting as much vaccine as possible in the community. And I don't want to give a timeline, but it's unfortunate that it's taken so long, because I have to say that this vaccine development was incredibly fast. I'm very pleased with how fast it was, because at one point they said maybe late summer last year when we were getting it. So we were already doing quite a large population percent so far in Pinellas. So I'm excited about that, but we have a long way to go for sure. And you're on mute. Just keep on off of mute.
I'll just keep it off because I keep forgetting. But so
We love
you know, so you know, faith. This whole webinar is about faith-based initiatives, and so we're seeing that faith-based communities are taking on an important role in all of this. And so one of the things that you're doing is you're facilitating a health equity vaccine task force. So you want to tell us about that and tell us about that initiative.
I do. Just recently in the Tampa Bay Times, there was discussion about the African American community going back to church more than ever after this pandemic. And I think a lot of people are looking for sort of a way to get through the suffering. So as far as health equity is concerned, this is not a new topic. You know, it has become to light because of COVID, but we know for a fact that African-American babies die at higher rates than white babies. We know that HIV is worse in the African-American population. So there's a lot of health equity issues that we've been working with for a long time, and vaccines are just another issue that we need to challenge ourselves with. So if you want to take a look at this slide, this gives you the breakdown of the 65 plus population in Pinellas County and how many are in each category. So if you look just at the first top, the white 65 plus community right now is 29% vaccinated, whereas the African American community 17%. So right there, you know that we're missing something. And I'll tell you, it's technology, it's transportation, and it's trust. So those are the three things that we really have to focus on. So the good news is that we're using the trusted elements in our community to try to reach this population. Next slide. So we brought together a health equity vaccine working group, and there are a lot of health equity groups out there, and I don't want to disparage any of them, but because the health department is helping to push out some of this vaccine with emergency management, we wanted to get together and talk about the data, because the data is showing us exactly what we already feared, is that it is disparate in how vaccine is being pushed out in the county. And again, the technology for a vast amount of people is not available. We want to provide education similar to this particular webinar today, as well as other information about the hesitancy and other issues with vaccines, as well as just trying to conduct outreaches. So what we've done is we've picked some trusted community outreach locations like churches and neighborhood centers and outreach centers, and we're going out there and we're doing the vaccinations. Now, the hard part is that we're not using the CDR website, so we're trying to limit that barrier. But if somebody steps up, like, for example, a church, you know, let's say Reverend Irby, for example, if he steps up and he agrees to help host a church event, he has to bear the brunt of a lot of the work. We bring nurses, we bring vaccine, we bring the EMS. But the actual site has to help get the community members. And the reason we do that is because we don't want it, we want to target the specific populations that have been left behind. So that's really our goal. So if you go to the next slide, this is where we've been just as far as late January. We've gone to some churches. We're going to the Hispanic Outreach Center on Saturday. We're going to a Laotian cultural arts facility next week, and we're just growing the list. You know, Reverend Irby has given me a lot of work to do, but ultimately this is how we're going to get through and I have to say, Mr. Bryant has another 400 people on a list already. So
Yeah.
once the word gets out and it works well, we want to continue to go out into the community and do this. And furthermore, someone asked me today, do we feel that this is a sustainable model? And in the community trying to get to where we want to go for health equity, I think once we find a church that works well, we'll just continue to go back, because the next big hump of vaccines that we're going to have to give are those under 65 with underlying health conditions and essential workers, which is just about everybody else in the county.
Thanks, Gayle. And as she said, I can attest to how well it works. We, this past Thursday, vaccinated 488 people at Shiloh there in Ridgecrest. This whole thing started down in St. Petersburg with Dr. Kenny Irby, who shared inspirational words with us earlier. Let me tell you a little bit about him. Dr. Irby is Director of Community Intervention and Juvenile Outreach for the St. Petersburg Police Department and servant pastor of the historic Bethel AME Church. He's dedicated to justice, without a doubt. So, Reverend Irby, I'm going to turn it over to you.
So yeah, thank you so much, Gayle. You're right. You know, I don't mind sharing the wealth and the opportunity for us. It has been an issue of creating partnerships, trusted partnerships. And Gayle alluded to the 3 T's, the TTT. I like to call it 3 to the third power, where we're talking about trust in intentional ways, trust in our God, a creator, from whatever ecumenical frame or lens that we focus on, trust in these places of faith where we already have some level of familiarity and comfort, and then trust in the faith leaders that will connect us with other resources that can help us to be effective. So the trust is about being able to rely on the empirical data. And we have some photos that we'll share with you that reference the kind of trust that we've established in working in partnership with the health department of Pinellas County. It is really about focusing on intentional strategic planning to bring the vaccine into some lesser served communities through the framework of equity. We're using the associations in Pinellas County of faith leaders to make that work become a reality in effective ways. We've used the pitcher catcher model, I like to refer to it, where we are funneling, if you will, or directing individuals in this particular 65 and over category from various centers to locations where congregants can be able to receive the vaccination. And we're vaccinating faith leaders, like in this photo where you see Pastor Reverend Dr. Wayne G. Thompson. Of the 8 sites, I've actually personally witnessed 6 of those. One of those also being our own congregation. To identify congregants, as Gayle alluded to, it's a heavy lift that requires planning and preparation and registering the residents that are within your congregations and faith centers, as well as the surrounding community. And so it does allow the faith center, the mosque, the temple, the church, the fellowship hall to be a life-saving station, which is really what we're trying to do in meaningful ways. The idea of trust is also required that we understand that there's some technological barriers that we are overcoming. That's where the second T comes into place. And so using a phone system, a network system, a class leader system, as some organizations like the AME Church already has embedded in its structures, we found to be very useful and to again, identify not necessarily the faith leader, but within the congregation, a reliable statistician, accounting person who will assemble the database so that we can make sure that we have the individuals and the information that we need to be effective. And then the third T for me is not just transportation, it's more about transportability. There are people that can't get out of their vehicles, that they have methodology to get to the sites, but we need to be able to serve them and meet their needs, and because they're differently able. And that is really an important item in this process. You know, each of the faith leaders, the elders and pastors that I've worked with have been incredibly responsive in demonstrating their desire and resiliency to respond. One of the questions for me is, you know, how did that work? Well, I was already privileged to be in concert with the health department through our emergency operations center and my role in the city. And I just made it known that I was really willing to step up and be a liaison, be a connector person to the faith community to make it work, and to come up with alternatives to the system that clearly was not able to meet the tremendous demand, the demand for individuals in the faith community and abroad who desire to be responsible and to act on receiving the vaccine is far greater than the supply. And we heard that eloquently stated tonight. The day of the event responsibilities, I think, are really important, and I agreed along with Pastor Murphy to be one of the test sites. A lot of learning was happening. I was given about 6 hours to turn around a response, and you know, all things are possible. I believe in my faith tradition and my trust in Christ, and we were able to rise to the occasion and demonstrate. The two things, Vern, I'll just drop on you that are really important, that faith centers are known for, and that's volunteerism. And so to be able to assemble that volunteerism, as Gayle alluded to, they're going to bring the medical expertise. And then there are resources that I can say here in St. Petersburg. We have multiple faith centers across the panoply of faith traditions that are really willing to join and galvanize. Your pastor called me. You know, that's a countywide connection, and said, you know, Kenny, I want to be a part, help me out. We're ready. So we were able to do that. And that volunteerism ultimately on the day of the event has to be manifested also in terms of the hospitality, providing a welcoming, safe space across the African American and Latinx communities is really essential. There are a couple of other photos you'll see. I mean, providing the order of the tables and direction. This is at the First Baptist Institutional Church, where Pastor Thompson sat in the foyer, just kind of overseeing and praying and providing leadership. That is essential. You know, just letting people know that we care, and to be patient and to be loving. And in every instance, it's been far smoother than some of the national tragedies that we've seen in terms of functionality and service.
Thank you, Reverend Irby. We want to turn it over really quickly to Arelys Escalera, who's the Community Outreach Coordinator, because people want to know how to get a hold of things and how to communicate. And I think part of what we need to do as the faith community is to make sure we're telling people the right thing so that they can get connected. So Arelys, we'll turn it over to you.
Good evening, and thank you for having me. I'm sharing here my screen with you, This is our main page for Pinellas County, pinellascounty.org. And on the top, you see that yellow bar that will take you to our COVID resources page, where you can find everything from the data dashboard to the vaccine information that we keep updating every day sometimes, right? Depending on what it's coming. And like Gayle shared before, here you can find how many people have been vaccinated. This one needs to be updated, by the way. And the key things that you need to know about getting the vaccine. Here is the link to the patient portal where you can register and request to receive your message back, either on a text message or an email when the vaccines are available, so you can make an appointment. The same goes for the pharmacies we have here, the Publix, the Walmart. Some of the hospitals and healthcare centers are offering the vaccines, but those are specific to their patients. And also for those homebound veterans, here's the link to where they can get the information to get in the list to get vaccinated. And so here you can find also the frequently asked questions. And there is a link as well that I'm looking here for you guys. What to expect once you get the invitation to go and get your vaccinations appointments. So it's in here. I think I went too fast. So that's another page where you can go and visit and get prepared on what you need to bring to your appointment. And we have, let me move these a little bit because the sharing on the top. This is the CDR Health Pro website, like Gayle shared before. You will get the link where you can create your account and decide where you want to get a text or an email when the vaccines are available. And we are sharing with you as well the link to the vaccine summary where you can get the information, and it's updated daily. Gayle shared that with us earlier as well. And here in Pinellas County Marketing and Communications, we are working with other community leaders in putting together a document that is a one-pager that will be available in English, Spanish, and Vietnamese. Common concerns that the people have. We're working with Dr. Cho and we're working with Dr. Jameson on answering those common concerns and common questions that people might have, so they can have that information readily available and they can answer their questions.
Cool. Thank you, Arelys. We're kind of at a point where we can ask her a couple questions really quick. And can somebody tell me, are the shots always free?
Yes, they are.
Facilities are allowed to charge an administration fee that normally goes to their insurance, but the vaccine has been purchased by the federal government and it better be free, which is why we worry about scams and we worry about people calling and saying, get on the list and give me your social security number or your financial stuff so you can get a vaccine. So yes, please.
Okay, cool. Someone asked about how are we able to service homebound seniors? Is there any methodology behind for that?
We're getting ready to work on that. Initially the vaccine push has been as many as possible, as quickly as possible. And now we're working with home health agencies. We first had to vaccinate the home health agency workers. Now we're going to home health and we're trying to have them work on their process. We're currently using the Pfizer vaccine, which has a very short shelf life. Once you open a vial, you have to use it within 6 hours. So they won't be able to do their routine visits in order to get that done. They'll have to make a specific visit per vaccine in order to use it as quickly as possible. We're also talking about with some of the churches. We had in the past done a drive up for some of the church missions, but we're also talking about maybe doing what did they tell me? It was like homebound. What's it called when you have the list of people that you're praying on?
Oh, the sick and shut in.
The sick and shut-in. So I think what we want to do that next time is we want to try, when you're making your list for your faith-based, to give us the sick and shut-in list and then try to go to them versus having them even come in the car. So that's kind of a new process that we're thinking about.
Awesome. Very good. I see. There's another question. What if a person received the vaccine who inadvertently had the COVID virus already?
So if you've had the COVID, sorry, I'll let Tracy answer if she'd like. But if
That's okay.
you have the COVID, we actually tell you to get the vaccine.
Yeah, that's the CDC guidance right now. Some people have noticed they get more side effects after their first round of shots, and those are people who have either had the virus and they knew it, or maybe they had it and they didn't realize it.
Okay, awesome. So let's see, going here. Let's kind of, for the faith-based folks that are here, Reverend Irby, can you, kind of come back and talk about how we can get involved, talk about, education, things that we can do as a faith-based organization to really help this process?
Yes, sir. Absolutely. We have been very deliberate about taking in best practices and learning from our experience. Number one is the mobilization piece, mobilizing folks as we prepare to bring them into facilities, faith-based facilities that have the kind of amenities and space to be able to serve large numbers, as Gayle alluded to quickly, is really important. I like to think of a point person in addition to the faith leader as a registration manager, so that we centralize that important information. We have to think about how do we connect our congregants and followers with this kind of information that we saw at the top end of the presentation, so that education piece is able to dispel some of the false narratives that are out there. We have to begin to think about how do we adopt other churches in that mobilization process and be inviting. And in many of our institutions, they're not individual congregations, but there's a collective. There's a lot of really helpful advanced work we can do, Vern, in terms of not only announcing the location, but for example, having sign-up sessions where folks can fill out the paperwork, and that facilitates the process that we spend a lot of time working with, and then creating call centers, having a phone bank. I can actually tell you from that the digital divide can be overcome quickly by just using a text thread, and funneling, having one person like we have here tonight, somebody monitoring and managing the back channels, to be able to flow that information into a main database. There's so many ways that we can do that, but it really begins with each one reaching on strategy and being selfless and not selfish.
All right. Another question here is, one of the churches has a large LGBTQ community, which is HIV positive. Are there any concerns about that they need to address? And perhaps they could be a host site, isn't it one part of the question?
Yeah, we would always want them to read the information on the fact sheets and make sure that they make an informed decision, or talk to their physician to make sure that they're not concerned about their immune response.
Okay. Let's see other questions. Lots of folks that are saying they're interested in participating with us, so we'll make sure that we get that. There was also a question earlier about contact information, and that would definitely be in the information that you get at the end of the meeting, so you don't have to worry about that. And here's a really good one. If there's RNs or other folks, nurses in their congregations, can they volunteer to help do home vaccinations?
We would hope that they become Medical Reserve Corps, because if they come under the umbrella of the Medical Reserve Corps under the Department of Health, then they get sovereign immunity. So it helps, we don't want to have medical professionals just be doing things out of their goodwill. We need to protect them as much as they can, especially if they're going into somebody's houses. One of the concerns we have about going into people's homes is that, you have to wait 15 minutes for them to resolve and make sure they're well. When we do the large sites at the churches, we have EMS either on standby or at the drop of a hat to call. One-on-one, we're concerned about a person being in somebody's home by themselves without having that. So we're talking about getting a pair of people to go out and do this outreach. And we would like to, in fact, part of my contact information, I'll let my Medical Reserve Corps person know. You have to have a license in the state of Florida. It has to be an active license. I know we have a lot of retired nurses, but even if you don't have an active license, if you want to help at one of the outreaches, I think just being able to, we use a lot of people that have medical knowledge in the observation area. So we give everybody a vaccine, then we have them sit for 15 to 30 minutes, and we have somebody monitor. And even those moms and everybody who watches people and knows when they're not feeling good, that's what we want. We want somebody who has very professional medical knowledge that can say, hey, you're not looking good, you're starting to sweat, you're starting to pass out, because we don't want them to hit the floor, we want them to be able to get caught. So that's really what we can use people for. But like Reverend Irby says, we need people. That's really, that's the service that's provided, is just coming, talking to people, asking them to help them fill out the forms. It's goodwill and good gestures.
All right. Great. Thank you, Gayle. So in our last couple minutes, just real quick, Tracy, anything you want to add to what's been said here?
A lot of admiration for the people who are running clinics in the community. I know it's a very heavy lift, and everyone's doing a great job trying to get out there and outreach to underserved communities in particular.
Okay. Arelys, anything you want to add?
We're going to share all these resources that we have readily available for you. And we're working on a video as well that Mary Burrell will share as soon as it's ready. And you can have also, she will share my contact information if we are of any help. Please reach out.
Cool. Thank you. Thank you. And Gayle, anything?
Just looked at our calendars, and the first case that we had in Pinellas of COVID was March 9th. So we're coming up on our year anniversary. When we got our first case, we all woke up at 3 o'clock in the morning and discussed it. And it's just, it's so humbling to know that we've come so far so fast, and I'm able to help get vaccine in people's arms and they want it. That's, my heart just stops when I know that people want it. They want to be safe and they want to do the right thing. They're listening to science and they're listening to their peers, and it warms my heart, and we're blessed for sure.
Cool. And Reverend Irby, I'll give you the last word, and you can actually close us out with a prayer after you've given us some wisdom.
Well, to God be the glory. Here's the deal. We, from where I sit, it is about mobilization, and this is a community that has been used to marginalization and disproportionality, and that's not to excuse it. That's just to acknowledge the tenacity of our Latinx community, our African American community in times of challenge. And so all of those big events that we've had, where you've had to have somebody in the parking lot managing the traffic, and you had the stewards and the trustees being hospitable, welcoming folk, it's the same kind of event where we draw from that muscle memory and institutionality to do good work for the community. I just believe that in times like this, we have to live our faith. And the word of God across several sacred texts call us to love our neighbors. And this work is really about looking beyond yourself and supporting the greater good. And I appreciate you for your moderation here tonight, all the panelists and all of the frontline health workers and medical staff that are doing this tremendous work. It's about a partnership.
Cool. So thank you all again. Again, all of your questions will get answered, and that will be part of the packet that we send out afterwards. And thanks to our great folks at EMS, Emergency Operations, Mary and Eurydice, who's helping us here today, and Jess, of course, who's our technologist extraordinaire. So again, thank you to everyone, and Reverend Irby, give us a closing prayer.
Let us pause. This is more of a benediction. We ask God that you would continue to look upon us with your grace and your mercy. May you smile upon us. May you hold us in the hollow of your hand. And as we pilgrim through this barren land, God, guide us, O thy great Jehovah. Bless us with the blessings we stand in need of, and we'll be careful to give you all the praise and exalt your holy name. Amen.
Amen. Good night, all.